Before we begin, I want you to imagine something with me. Picture a massive library, a place filled with millions of books, every memory, every skill, every word you have ever learned. Now imagine a fire starting at the center of that library. Every minute, 2 million books turn to ash, gone, forever. No alarms, no screams, just quiet destruction. This is what happens inside the human brain during a stroke. For every minute without treatment, nearly 2 million neurons die. In those 60 seconds, your brain ages the equivalent of 3 weeks. In 1 hour, almost 3.5 years of brain aging slip away. Most people think a stroke looks like someone collapsing dramatically. But the truth is far more frightening. It can happen while you're drinking coffee, while you're sending a text, while you're sitting on the couch. No pain, no warning, and by the time you realize something is wrong, the fire in that library may already be halfway through the shelves. But there is a way to catch it early, even before the flames swallow the room. And today, you're going to learn exactly how. Let me take you into a quiet Sunday afternoon. Robert is 62, healthy. He jogs a few times a week. He laughs loudly, tells bad jokes, and has never spent a night in a hospital. He's at a family barbecue, holding an iced tea in one hand. His daughter says something funny, and Robert laughs. But as he lifts the glass, something feels off. His fingers don't grip the way they should. The glass slips and hits the patio. It shatters. Everyone laughs. Even Robert laughs. He bends down to pick up the pieces, but something inside him feels strange. Not painful, not dramatic, just strange. He tries to say, "I'm so clumsy today," but the words feel thick, heavy, like his tongue is a size too big. His daughter stares for half a second longer than usual. Most people in Robert's shoes would say they're tired. They'd sit down, maybe take a nap. And that nap might be the worst decision of their life. So how do you know? How can you tell if it's something small or a catastrophe unfolding in real time? There's a simple tool that paramedics and neurologists use around the world, and every person watching this needs to memorize it. It's called the FAST test. Face. Ask the person to smile. A stroke interrupts the brain's control over facial muscles. If one side of the face doesn't lift, or if the smile looks uneven, that's a red flag. It's not the muscles failing, it's the command center failing. Arms. Ask them to raise both arms, palms facing up. Tell them to close their eyes. This is called the pronator drift test. Closing the eyes removes visual compensation. If one arm drifts downward or rotates inward, it's a strong sign the brain has lost control of that side of the body. Speech. Ask them to repeat a simple phrase like, "The sky is blue." There are 2 types of speech problems here. Slurred speech, where the words sound thick and unclear, and aphasia, where the person knows exactly what they want to say, but the words don't come out right. They might say the wrong words, or nothing at all. Their language center is failing in real time. Time. This isn't a test, it's a command. If any of these signs appear, even one of them, you call emergency services immediately. Not your doctor, not a friend, not the neighbor. Seconds matter. But there's something fast doesn't catch. a hidden class of strokes that don't show face droop or arm weakness. These strokes attack the back of the brain, the cerebellum and brain stem, and they change your balance or your vision before anything else. That's why we upgrade fast to be fast. Balance. A sudden loss of coordination, walking like you're drunk even though you haven't had a sip, the room spinning, falling to one side. Eyes, double vision, blurred vision, or vision suddenly going dark in one eye like a curtain dropping. Fast catches most strokes. Be fast catches the ones fast misses. Now let's go deeper into Robert's story, because what happens inside the brain in those moments explains everything. Inside Robert's head, one of the arteries feeding his brain has just become blocked. When that happens, there are two zones of damage. The first is the core, the area that dies immediately. We can't save that part. The fire has already burned those books. But surrounding that core is a much larger area called the penumbra. It's starving. It's fading, but it's still alive. It's the section of the library where the flames haven't reached the shelves yet, but the heat is rising. This is the part we fight for. If blood flow returns quickly, the penumbra comes back to life. If it doesn't, those cells die and the damage becomes permanent. And this is where modern medicine is nothing short of incredible. Today we have clot-busting medication that dissolves the blockage. We have endovascular surgeons who can thread a catheter from the leg all the way to the brain and physically pull the clot out. But the effectiveness of these treatments drops every minute. The clot buster typically has a 3 to 4.5 hour window. Thrombectomy can be performed later, but even then, time dramatically affects recovery. This is why napping during a stroke is deadly. You're giving the fire more time. Now here's the part most people don't know. Sometimes a person has stroke symptoms for a few minutes, and then they disappear completely. The face droop goes away. The speech returns. The arm works again. People celebrate. They say, "I feel fine now." This is not fine. This is a TIA, a transient ischemic attack. Some call it a mini-stroke, but that name is dangerously misleading. There is nothing mini about it. A TIA means a clot formed, blocked blood flow, and then dissolved on its own before permanent damage. It's the body firing a warning shot. Studies show the risk of a massive stroke in the next 48 hours is extremely high. Some studies estimate up to 8% within the first week. A TIA is a countdown clock, not a relief. Let me add one more layer of understanding, because people often confuse stroke with other emergencies. A heart attack is about pain, crushing chest pressure, sweating, nausea. A stroke is about losing function, losing the ability to speak, to lift an arm, to smile, to walk straight. Pain isn't the signal. Dysfunction is. There are also stroke mimics, conditions that look like stroke but are not stroke. Low blood sugar can cause slurred speech and confusion. A migraine with aura can cause vision loss or numbness that spreads slowly. A seizure can leave a person temporarily weak on one side. Bell's palsy can cause a drooping face. But here's the golden rule. You are not expected to diagnose. You are expected to act. Call for help. Let the CT scanner make the final decision. Doctors would rather see 10 false alarms than one true stroke that was ignored. Now, let's go back to Robert. His daughter watched him for just 1 second longer than usual. She noticed the odd smile. She heard the thick words. She didn't let him lie down. She didn't wait for him to feel better. She called an ambulance. When paramedics arrived, they performed the same tests you just learned. Face, arms, speech. They checked his balance. They checked his vision. They noted the exact time the symptoms started. This small detail, the time of onset, decides everything. It determines what treatments he's eligible for. Robert was in a scanner within 30 minutes. The stroke team was waiting. Treatment started quickly. The clot was dissolved. Blood returned to the Penumbra. And because the fire was stopped in time, Robert walked out of the hospital 3 days later. His memories intact, his personality intact, his life intact. All because one person recognized the signs. And that person wasn't a doctor. It was his daughter. You don't need medical training to save a brain. You don't need a degree to protect someone's library. You just need awareness. You need to remember the sudden changes to watch for. You need to remember BEFT. You need to remember that time lost is brain lost. And you need to act. Share this knowledge with your family. Send it to someone you love, because the conversation you have today might be the reason someone stays alive tomorrow. Stay curious, stay aware, and I'll see you in the next video.